Good afternoon, everybody. Welcome to the Mason County Board of Health regular meeting for September 25th, 2018. I'd like to thank Peggy for filling in for me at the last meeting. Appreciate that, Peggy. Next item is the approval of the agenda.
I make a motion we approve the agenda as presented.
Second?
All in favor of approving the agenda as submitted, signify by saying aye.
Aye.
Motion's carried. Next, we have the minutes from the meeting of July 24th, 2018. Have you had a chance to review those?
Yes.
Any corrections or additions?
Make a motion we approve the minutes
I
as
second it.
presented.
Good. All in favor of approving the minutes of July 24th, 2018, signify by saying aye.
Aye.
Motion's carried. Hello, Terry. Dr. Yu, you're up next.
You know,
would?
what I have for you is that you need to go get your flu shots, okay? And that's all I'm gonna say, because I think we're gonna have
Okay.
a short meeting. We have the update on the opioid overdoses and the community health assessment that we're gonna be talking about.
Okay.
But reminder, the flu shots are available now.
Okay. Good point.
Is this one working?
Well, you know, every year it is a guess as to whether or not it's going to work and how well it works, but you don't want to find out after the fact.
Just get
that-
it.
Yeah, I usually never
Yeah.
get it, but.
Well, I get it every year, and once in a while, you know, it doesn't work as well. Last year's did not work as well. This year's a new formulation, so,
And I actually have read recently that if you do get them every year, you are more protected than
Protected, yes.
somebody that doesn't. Because
That
you
makes
have
sense,
more
yeah.
immunity to more of the
yeah.
alleles.
So when they tell you that you have to get the flu shot every year, it's not that the immunity from the flu shot wears off. It is that the flu virus changes every year. So, you know, having taken the flu shots for 40 years, I am more protected than somebody who's never gotten a flu shot.
What about the senior boost?
I
If
would
you're over
recommend that
65.
if you're over 65.
Okay, so the flu shot and the boost?
No,
that
it
it's-
is.
Oh,
It
it's
is,
called-
it is a,
High dose.
it's a
Okay.
higher dose, so instead of the regular amount, they give you 4 times as much.
Oh,
Yeah, so you get this, and,
blast me out of the room.
well, they assume that people over 65 have immunity that doesn't work as well. So some people's immunity at 65 works just as well as anybody else. But they're, you know, they use that cutoff of 65, they recommend the higher dose vaccine. And I have to debate whether or not I'm gonna do that this year, because I've reached that magic age. So I'm gonna have to
I
make my
just do
decision.
it.
I probably will.
So you give us a report at the next meeting if you got the boost.
Bouncing off the walls.
Yeah.
A year ago, we were talking about the flu. The suggestion was made, maybe we should go ahead and look at trying to cover the.
Provide the homeless.
Yes.
Yes.
And
Um,
the avenues would be done maybe at the community dinners, and has there
Yeah.
been any more thought about that?
It's purchasing it that's an
Yeah.
issue. It's the funding for it. So we do connect, so we did connect our homeless population, we connected with some different organizations, and our veterans all got offered
Their
it
flu
last
shots,
year.
yeah.
So, and we talked about it, I'm trying to think, we've talked about it, we'll talk about it again for the point in time count, because that would be the, it's a
That
little
would be the
late in
ideal.
the year, but we
I-
still
I-
get- our flu season's late in the year.
Yes,
We're
and
usually February.
flu usually starts coming in like December, and then school lets out, and it doesn't spread until school gets back in January. Then it starts spreading, and then we get widespread flu around the end of January, February. That's when we typically see influenza in our community. And I'm not talking about random colds and things, because we can still, even if you get the flu shot, you can still get a cold.
Mhm.
It's not the flu. In terms of getting flu shots to our more vulnerable folks who are lower income, it is a matter of finding the resources to get. So if we have some way of getting financing for flu vaccine, we could probably find a way to deliver the shots.
What are we looking at financially for to do something like that?
We haven't bought flu vaccine recently, so I don't know what the cost is. But in general, the vaccine itself has not been that expensive, but you have to order it,
In
in
April.
March.
Yeah.
And then it is available at this time. Every once in a while, organizations like AmeriCares will offer it for free, and they will give it to like health departments. So we've used those in the past, to provide vaccines, but,
So if
Yes, but
Mason
say-
General could find a way to fund it, if we could find a way to fund it, there's no guarantee you'd be able to go ahead and obtain the quantity of flu vaccines.
It's not
that
like,
you need.
it's who you're trying to provide it to. So we may maybe have 25 or 30 in our homeless group that pass through at any given time over at the shelter. Whether or not they're willing to take it is another question, because again, people aren't always willing to take vaccines.
Sure.
But we would certainly take an opportunity and look for an
Right.
opportunity. We do every single time, so we would definitely
Okay,
look for
could you send me an email
Send you an email.
and give me an idea how much money you need?
Well, I don't know that we can buy it, like Doctor, you said, we would have
Yeah.
had to order it last
so
March.
one of the ways is, the hospital, for example, purchases
Right.
vaccine for their
For our
staff every year.
Right.
And sometimes, some years they purchase a little bit more than others, and they have vaccine that they are not gonna end up using, for example.
Okay,
So come January, we might be able to avail of that
okay.
vaccine
Mhm.
and use that.
Okay.
But if we were wanting to provide vaccine to segments of our community, we as a health department would have to order it in March or whenever. I can't remember anymore.
Yeah, I think March is forecast order in April.
Yeah, something like that, where we would have to, put in an order so that we are in the queue to get the vaccine.
Maybe that's something we should put on our agenda for
January.
next spring
January.
or
Mhm.
something.
January.
Would be,
The
I
time
think
to
January would be an
discuss it.
appropriate time to discuss that and see if whether or not we have the capacity to do it
Mhm.
ahead of March, cause I think we'd meet late March, and by then it might be
Good point.
too late, so.
Right. And I've done one of these in Stevens County where we received the vaccine specifically for homeless and low-income populations. We went through the food banks. We had 13 different food banks that we worked with. And we thought that'd be a great way of doing the outreach. Of all those 13 food banks, we administered 25 doses.
Yeah, that's what I
Mhm.
heard.
So-
I mean, I've gone to Salvation Army to give flu shots and, go there for an evening and give one dose.
Yeah.
The homeless shelters, the, Turning Point, the
Different,
Crossroads.
yeah, I mean, there's certainly opportunities, to go out there.
But whether or not they'll
Whether or
take
not
the
they'll take the
opportunity.
vaccine,
Yeah.
Yeah.
It's part of the
is part of the question.
It's
So-
worth a try.
Yeah.
Maybe
Worth
in,
discussing again.
maybe in the meantime, we could reach out to those organizations and see what their interest level would be, I don't know,
We have talked,
yeah.
we're in conversations with them about that and different things. So what might be, for the homeless might work better is getting them, someone to sign them up for services,
Mhm.
for medical services, cause many of
Cause
them
then they
don't
would
know
be
that they-
covered anywhere
Yeah,
they
then
went.
they'd be covered and we could supply some things, but yeah, we can, look, it's that, you have to buy the vaccine in advance, so if you have 25 take it and you bought 500 doses, it's quite a loss.
Sure.
On the other hand, if something happens and the vaccine hits and we have a really tough flu season, we tend to see stuff come down from the Department of Health.
Yeah.
And then we have that for free, so like we give, the vaccine for the Tdap, the, pertussis and stuff, we give that free all the time. So we always grab at any opportunity we can have free vaccine. We don't
And,
wanna see
and
the
it's,
community.
it's not, we will find a way to get it into the arm
Yeah,
of folks. That is not gonna be the limitation. The limitation is getting a hold of the vaccine itself.
I know you probably checked this, but the tribes have clinics
Mhm.
initiate that. Have you checked with them?
we work with we work with all the immunizations across the whole county, so yeah, but again, their vaccine that they get they have to purchase as well in a year in advance for populations, unless it's the vaccine coming for the children, and that's a different issue. So, but, yeah, we can inquire
Okay,
and
good
give
discussion.
information back.
Thank you. Dave? Dave, do you have a report you'd like to?
So, okay,
share?
so I was gonna touch on finances a little bit. 'Tis the season, I will pass these around. And this is just an FYI for board members. It's, there's 2 pages. And this comes out of what's called our BARS reporting.
Are you in the quarantine over there? Okay, got it.
So.
Oh, sorry about that.
That's why we come back around though.
So what this does is it breaks out all our sources of revenue that come in through public health by program, which is really by the BARS code, and then what the county contributions are. And then at the bottom of the page, second page, it breaks out how much is county contribution, how much is state dollars, how much is federal dollars. It passes through the state. So this is and I've got the book for all the counties. So for me, I use it to compare against what other counties are doing. Some counties, for example, we're at 14, so say 15% for us. Some are as low as 3.6% county contributions. Others are as high as 67%. So it just depends on the circumstances. For example, I think it's Skagit County that has the landfill, right? The big landfill.
Look at that. Look at that.
Click at that. Yeah, they're very well funded through their tipping fees for public health. Very, very well funded. So other places, not as much. But this gives a good breakout of where we're at. Currently, year to date, we are right on track. We are at 67% spending, so we're right on target. It's about exactly on target for year to date. So our spending is on track, and revenues are pretty consistent because they're really grant based mostly. So we know in advance what we're going to get and when, and where we have variances is some of our contracts. Say we'll have $20,000 in a contract, but if it's a fee-for-service contract, we're not allowed to bill for that until we work in that program. So there's some programs that we don't work into until we're invited to come work in them, providing support to community services. So that money may sit there in the budget and may not get touched unless we're invited to work in those programs. I think of EIP.
Early intervention.
Yeah.
Program, which is
So-
gone now, as of,
What's that?
it's gone as the end of the week.
Yeah, so it's going away. So some of these we can't touch, and all of them are on reimbursement now. None of them are, for the most part, pay in advance. They all used to be pay in advance, so you were able to build something of a reserve. Now the way that the financing is done, there's no ability to build reserves. It's just all reimbursement. So it does make planning and expansion difficult if you can't build any kind of reserve in place. And then if you do have some bad times, or for example, an outbreak, and I'll use an outbreak that I dealt with. We had pertussis, the outbreak in a daycare, 50 kids on the Friday of Memorial Weekend. And those 50 kids went to 5 different states. So we had to track down all those families in 5 different states and provide antibiotics, prophylactic, to those people wherever they were. And it cost, just in direct staff time, $40,000. But because staff was working on that and not working their normal programs, we weren't able to bill, so there was another $40,000 cost. So that outbreak was an $80,000 outbreak. So this goes to show where we're at with the funding. As we went into funding negotiations last week, and we're talking about the big ask for Foundation Public Health, one of the things I proposed was for small jurisdictions such as ourselves, small and medium jurisdictions, that whatever money we receive, that we set aside money for, say, an emergency bank account. $200,000 that medium and small health jurisdictions could tap in the event of an emergency. You have a public health crisis comes up, smoke, or you have to evacuate. Something comes up and you can't tap your normal billing sources for a while. This fund would be available out of the foundational public health money as an immediate draw for health districts that are having an immediate need before we come back to the normal state system and maybe shift resources from DOH or shift resources from another health jurisdiction. It would just give people the ability to react to an emergency in a quick way and get some funding. So everybody liked the idea. DOH thought it was a good idea, so we're going to be fleshing that out in the next couple of months and hopefully go to the legislature with a policy bill that would include that as part of the funding. We would say, of the funding we're going to get, we want to set X amount aside to deal with emergency response that we can control on our own. So it sounds like it's going to fly. We do have a policy bill going forward that for the first time ever will give WSALFO, our State Association of Public Health, the ability to have concurrence with DOH on the money that DOH receives for foundational public health work. They would go out to the counties and go out to DOH and go out to the Board of Health. It would give us concurrence on how that money is spent. That's the first time we'll ever have a voice in how the money actually gets out there and gets spent. We spent a lot of time talking with John Weisman. He's on board with it. His whole staff is on board. So I don't see any reason why the policy bill along those lines shouldn't pass. If DOH and WSALFO can agree, I think it's the biggest step I've seen since I've been in public health.
Do you feel that the current cycle that we're starting over in Olympia is going to go ahead and give public health an opportunity to request and obtain additional funding?
Well,
Because the pressure is off with the schools
There's
to some degree.
There's a lot of things that we're juggling right now. So I went to the WASAC this last Friday, the State Association of Counties.
Say what you called it.
What's that?
Say that thing you called it.
Or
what I've heard.
Oh yeah, we talked about a lot of things. We talked about salmon. We talked about indigent defense and culverts, and somebody asked me my opinion on it. I said we should probably house mentally ill, transient salmon in public health culverts. So, and what they're asking for is about $1 billion across the state for culverts, for transient legal services, and the county commissioners are all on board with supporting public health's asks to the legislature. So we went forward with the ask, and nobody batted an eye. Everybody understands how much foundational public health costs the counties to do, and if we can get some support, the commissioners were all on board with it. So we had great support, answered a lot of questions afterwards. So now it's just a matter of working with our other partners, the Hospital Association, the Nurses Association, those folks, and get them on board, because I hate for them to think of it as a threat to funding that they might receive. And there's been kind of that feeling sometimes in the past. So you never know as you go into legislative session kind of how your allies will line up. But we're doing a lot of groundwork right now to make sure we get as many on board now before we get to the legislative session as we can. We've got a lot of new legislators coming on board, both in the House and Senate. There's a lot of faces that are going to change. So there's going to be a big opportunity to go in and do some education. In that first week of session, it's going to be all hands on deck in Olympia, talking about foundational public health, what it means, and how we can save state money.
Good. Sounds encouraging.
Yeah, so it's really our first opportunity to go upstream and try to keep people out of the system in the first place.
Wow.
And I think probably the major reason that the Association of Counties Board didn't bat an eye or legislative steering was that we have this State Department of Health on board with this ask. Now, I didn't think to ask, so that actually has to be an agency request, so could OFM then?
So
that down?
here's where we're at in the process right now. We spent the last month and a half writing the budget request, we rolled it in under DOH's budget. So DOH submitted the ask for us on behalf, and just right up front it says on behalf of WSALFO and DOH, State Board of Health, this is what we're asking for foundational public health. And that's the first time that's happened as well. And in the past, they've always been at separate funds, and in separate funds, they become targets for, you know,
There's a lot of phone calls behind those asks.
Right.
Yeah.
Right. So, this is about the first time, so it's obviously Rusalfo's big push this year, because we've been working on this since 2010, I think was my first involvement with it. The counties are on board, DOH is on board, so for the first time, we kind of have the trifecta of things lining up to go forward, and that's, I think we stand a chance. Are we gonna get the whole ask? No, I don't see that happening. And even if we got the whole ask, we couldn't spin up enough people out of the strategic stockpile of public health folks to get them all on board that fast. So it's gonna be a staggered ask, so.
Go in the right direction.
Go in the right direction, so if it goes through even close to what we anticipate, we'll have enough money to do a full-time assessment person. We'll have enough money for a full-time school safety and lead person to work with the schools and make sure drinking water and septic, all that stuff is taken care of. We'll have water for water quality, or money for water quality. There are a number of big advantages to this. Because the way we wrote the policy bill and we've written the ask, it's about communicable disease, environmental health that's not fee supported. So all those investigations that we don't get paid to do, that we do, we have some money to support that, and then assessment. And we wrote it flexible enough that we can say water quality is part of communicable disease as well as environmental health. So it gives us greater opportunity to access funds than if we had not been as flexible with our wording. And it gives us the ability for the shoreline counties, the Puget Sound counties, to have funding and use that same funding in a different way than Garfield, Soden, Spokane, Lincoln, because the needs are different sides of the state. So we tried to write the legislation in a way that's, we can pivot, you know, depending on the local ask or the local needs.
Have you hooked up with the fire people?
Fire people, in fact, we're going to be talking about that with the opioid piece. So
Okay, but I'm thinking air quality from wildland fires is getting to be a public health issue.
yeah, and we are actually working on that with DOH and Wasalfa and DNR.
Okay.
So because it has come up more often. When I was in Stevens County, we had ash falling almost every summer for a while.
Right.
So
I
Yeah.
have a place in Okanagan,
oh yeah.
and I got choked out, really.
You
Had to
didn't have
leave.
to go to Okanagan, you could have gotten choked out right here.
Yeah,
Yeah.
and I came back and it was here.
Yeah, yeah. Thanks for bringing it back.
Yeah.
Yeah, I did.
Yeah.
Yeah.
So yeah, in 2015 we had to evacuate the Republic Hospital and the Republic Nursing Home
I remember that.
because of the fire, and it really put public health through its paces as far as okay, now where do you shift beds? We had to shift beds from Colville to Spokane to move patients from Republic to Colville.
Bottom line is to prevent the fires.
Yep.
Yeah.
Right. Cause it's just happening every year in the summer.
Mhm.
Anything else, Dave?
That's it.
Any questions of Dave or comments or feedback? Good report, thank you. Alex?
So it's been a very busy summer for us. DH being heavily vested in permitting. We've seen an increase in permits this summer along with building and planning, so our staff's been very busy as well. I'd say sewage permits are up about 20%. Also moving forward, we've been working on our permitting software change, which is supposed to roll out towards the middle of October, so next month. So we're getting towards the end of that. We're supposed to start training with staff next week. So we'll be very busy going into fall, and probably throughout fall dealing with efficiency and policies and procedures and changes to all those permitted activities. So other than that, it's pretty quiet.
That's why we like it.
Yeah.
Can I ask a question?
Yes.
This increase in on-site sewage, do you have a feel for whether that's new construction or people replacing? What this 20% increase? Do you know if that?
Is it new or?
Yeah, a lot of it's new, but it's probably an increase on both of them. I don't have them with me, but
Okay.
I can get you that.
I'd be curious to know.
Yeah.
Thanks.
Thank you. Hi, Lydia.
No?
You wanna join us at the table?
Sure. I can see faces. So you got my manager's report kind of on what we're doing, cause, we've got a lot of different projects going, and you can, if there's any questions on that, I'll try to answer those for you. But then we were gonna talk about kind of what was listed under Dr. Yu, opioid discussion, and then we're also gonna talk about community health assessment. So, I'll be mindful of the clock, I think we're good. So I'll start with, and we had our stakeholders meeting up at Alderbrook, week before last, I believe it was, and it was the largest one, and some of you were there. We had, I think, 45 people present, good mix across the county, a lot of different divisions. There was a lot of, I was most excited about the communication after and before. People are starting to connect together and saying, oh, I can do this piece with you, and that's what we've been wanting. That has literally been our goal for this project, so that was really exciting to see. So things are moving along well with that. And we put out this, Allison actually created this little flyer we gave out at the stakeholders meeting. And we're also having on the back of it, you'll see the forum is tomorrow night from 6 to 9 at the Transit Center. You're all invited. It is actually I'm gonna let Abe, talk about who's all doing that. Not my staff isn't talking. Dave, you wanna give a quick overview of what's happening?
Yeah, so the doors open at 5:30, goes from 6 to 9. There will be resource tables there for different treatment agencies and resources from the area that have volunteered to be there. Dr. Khan will be the keynote speaker. He's an advocate for medication-assisted treatment, and got some great insight. And there will be 2 other speakers, someone with experience as a family member in regards to opioids, as well as a person in recovery. And then a lot of networking is encouraged along with resource tables.
And it was organized by?
Organized by BHO. There's a Mesa BHO in the advocacy board in partnership with the public health office here in Mason, and as well as Thurston. And then the Thurston County Forum is the following day, on Thursday night, same times, and it's at the Thurston County Fairgrounds.
So this would be the third forum that we've had, third year in a row in September. And so we were looking to, our stakeholders and everybody looking to do one, and then the Thurston Mason Behavioral Health Organization advisory board said they were interested in doing one. We thought, well, we'll just piggyback on that. So we worked together with them on this. So there's some fun statistics on there. I also want to call attention to the community partners. How many do we have now, Abe? Because you added some more.
We have 24 formal partners now.
Which means they've signed an MOU or a letter of participation, not just support. And they're definitely all participating, which is very exciting.
So just a little bit about the overdose reports is that these are reports that have been turned in. So this is not a total number of overdoses that have occurred in our county. It's just of the reports that we have verified and we have received. But it's the same players. We started making it reportable in March of 2017. And in 2017, the calendar year ended in December, we had 5 fatal overdoses, and to date, we have had 0. So hopefully that will hold out till the end of the year. It's very interesting, it kinda comes in waves. Some weeks we'll have a couple and then nothing for a while. And, so we also get the report from the coroner's office, so that if there are deaths that are occurring due to an overdose, we will hear about it. Because we've made it reportable, we're probably hearing about more. And we also get a lot of anecdotal reports, which we cannot verify. So we don't add that to the statistic because we don't know, who is what. But we are collecting the information because we're providing the outreach and trying to get out the Narcan. And whenever people use the Narcan, the rescue drug, they come back for a refill. And when they come back, then they tell us about their overdose and how they used it. And, for us, it's good. It's why we're giving it out, so that people can use it.
And you have a good supply.
Yes, to a partnership with the University of Washington Alcohol and Drug Abuse Institute. They provide us with the Narcan, which we share with our law enforcement and fire community.
We're signed up.
Yeah.
And we have really good participation with our firefighters and our
They've been
EMS. Doing really
awesome.
Yeah, it's working really well. There's been some confusion along the way about some not knowing whether they're supposed to report, and that's all getting tightened up, so I'm kind of excited about that. Plus, I think North Mason Fire Authority, Bo, out there is working on the Leave Behind program.
Yep.
Say anything about that?
Yeah, so we're still in discussions. Tacoma Fire kind of led the charge in this, and they created a program to be able to leave behind naloxone kits with folks that they responded to, and then they refused to go to the hospital, refused to be transported. So Bo and I went up there and talked with them, got all their paperwork, and so we're waiting for the final okay. We've been in conversations with Dr. Hoffman, who is in that discussion, and we're hoping to implement our Leave Behind program here in Mason. So we've got all the proper paperwork. It's just a matter of working out the details.
So excited about that. And then it says on the one side, it talks about public health, and we're currently, the organizations that we're partnering with, and the 3 programs that we're doing for our opioid response. Doctor, you started the response back in summer of 2016. And got into some conversations with the Department of Health, who was getting data and looking that our data was very, very high in the state, and offered us our first program, which is the prescription drug overdose program that we've been doing now since officially started it in March of 17. Was when they finally got us funded so we could move forward. And that's the one that's been doing the naloxone education, the overdose education, getting the naloxone kits out. Christine is on vacation right now, or she'd be here, but she's down at the transit center every Wednesday afternoon with a table, doing education, talking to people, getting a really good response to that. And she's gone through, I don't know, umpteen number of agencies in the community have now invited her in, including jail, and now Department of Corrections is inviting, trying to get education for their people. And including in the jail, it's the inmates as well, getting trained. So had a really good response. We continue to have another year of that program. They just increased our funding. That's how we brought on Christina full-time. It starts October 1. She'll start full-time, so there will be more to do. The Comprehensive Opioid Abuse Program is the one that we've got COPE, which is the one from the federal government. It's our federal grant from Bureau of Justice, and that's the one that AID's working on. Started working on last March, March of 18, yeah. And that one's going really well. That's the one where the stakeholder meetings are involved and all the partners that we have formal formal agreements with, participating, finding out how we can connect the agencies together, do a little bit more of looking at our system and our community and how people travel through the needed recovery. And is it working? And where are people falling through? And so we're working with the hospital, we're working with all the behavioral health organizations, the substance use treatment organizations, our law enforcement, our fire. And we're excited about how well it's going. It's going really well. One of the things that we brought up, Dr. Yu brought last January, actually, was the need for a syringe exchange and talking about that. So I'm here to say, Yahoo, you'll see, and the third program, Substance Use Mobile Outreach Program. So the last time we talked, we had indicated that we were going for a grant, and it was the Medication Transformation Grant that's going across the state of Washington. Our region is the Cascade Pacific Action Alliance, CPAA, and we did apply for a grant, and we did receive a grant, and so did Mason General Hospital received a grant. As a matter of fact, you'll see, oh, it's not in this one, is it?
Did you get the
Our partners.
community health one?
Say what?
Did you get the EMS one? The
They got
community health?
they got all of them.
They applied for
They applied for everything, and Peninsula also applied and was granted funding. So we have a lot of support coming through the community through this grant, so that's really exciting. And there's all different
How much did
pieces.
you get for the van? The RV?
Well, the full amount of money. Well, let me
Oh, I'm
finish.
sorry.
Let me finish.
I'm
I'll
just
get there.
excited to
I'll
hear
get
this.
there. So we're very excited that we're. Our estimation was hopefully. I looked back at the minutes from Board of Health, and the hope was that by September, we're actually going to be starting October 1, so that was pretty close. And so then there's another piece of paper. This little one, the 4 squares. This is about the substance use mobile outreach. We're not calling it a syringe exchange on purpose because we don't want to just do syringe exchanging. We want to have an outreach to those that are having substance use disorder and see all the ways we can help with recovery and harm reduction. So we're expanding out as big as we can. The goal is to have a recreational vehicle that is a Class C. Dave's going to find us. We've already found a number, so we're waiting for the funding. I believe the commissioners will be signing, hopefully, that on October 2nd. We finally got the contract through. And they, from CPAA, they gave us just a little over $60,000 per year for 4 years. Now, I can't say just per year because, frankly, the whole Medicaid transformation project, the way you bill for it, I don't totally understand yet. You're doing it based on outcomes, and so we're at least having a base.
Pay for reporting on the first 2 years and pay for outcomes in the second 2 years.
Yeah, so there'll be probably more than that, but I can't say how much. So, but at least it's a start.
You
The
know your
Department of
outcomes yet?
Health.
Do you know your outcomes yet?
Do we know our outcomes? Well, that also they gave us, and they're a little fuzzy, so we're going to be working on that. We have to have that ready by the middle of next month, so we're starting to write them next week. Department of Health, we had found supplies, other syringe exchanges with supply funding for supplies with McKesson Health Organization to buy them from, and it's kind of an in-kind type thing. We had thought we were going to get $25,000 by the time we got approval and got started and looking again. They had already given it away, so they gave us $75,000 to start, and then Abe has been going out in the community. He has done an excellent job in this outreach of all these partners. He's literally talked to every one of these numerous times, and I think it's why we're getting such a great support. And in that, we've also talked with our tribal partners, and Squaxin Tribe is very interested. They've had a number of overdoses in the parking lot of the casino, and so we've been talking with them, and so they gave us $5,000 grant towards the project. And we're talking with them about having one of our sites where we're going to be located with the van they're gonna choose it over in their area there, so that's the other thing that we're looking to do. And we're talking with Scope Comish, he has a meeting with them
I present to the tribal council tomorrow afternoon.
to talk about doing the same thing up on the Scope Tribe. And then we'll have another site or time that we'll be there in Belfair, and we've got the people over in Belfair, Bo, and everybody's looking for what they feel would be the best place to do that at, and then we're finding another one here kind of in the city of Shelton. So we're gonna start, it's a project, right? We're gonna start a pilot with 4 locations that will run once, each of them will go once a week. So it'll be 2 days mainly, and part in 2 different locations, and then move to another 2 different locations another day of the week. That's how we're gonna start. We kind of patterned it after talking to our surrounding counties and how they've been operating different.
So you have
similar
one
things.
van,
One van.
so a half a day you're one place, half a
Yeah,
day
probably
you're
not a
another?
half a day. It'll probably be a
Couple
few
hours.
hours. Probably be a few hours. And again, that will depend. If one area seems to be really high, then we'd probably expand the time we're gonna be doing there. If another one's not working, we may find another location to go to. So it's gonna be and then we're going into fall and winter, which is tough because you're outside.
Right.
So we'll see how it goes. We're gonna be watching it real careful. We've invited many of our community partners to participate with us. So Peninsula Community already we've talked with them months ago when we went into the thing, and about them having one of their community workers their peer recovery community workers to see about getting people into treatment that want to get in treatment, because that's part of what we're really wanting to do here. We're going to be talking with the hospital about some things. So very excited about different types of things we're going to be doing in it. Next thing, we'll be buying the van. We did figure out disposal, which we have to tell Grays Harbor because they're spending an awful lot of money. And I think this might be a better way for them to do it. But we're going to get a Conex container, and it's going to be up at, we already talked to utilities, they have a place for it, and all of the Sharps containers will be put in there. And then it'll be emptied as needed. Probably for us, it might be once or twice a year.
Why don't we just contract with them and give them a 3rd discount on what they're paying?
Contract with,
Grace Harbor.
oh, good idea.
There's your money for your.
There's
So where is the disposal box going to
For
be,
your
did
shots.
you say?
Up at our
Transfer station.
transfer
Okay,
station.
all right.
And then it'll be dumped as it gets full. It'll be locked and dumped up there.
This is patterned after what they do in Thurston County.
It's one of those big
Big,
It's a
giant,
big,
dump
big trailer.
trailer thing.
yeah.
I think it's
So,
bright red.
yeah, I'm curious. I'm gonna talk to them over in Grace Harbor because I'm not quite sure why they're paying Stericycle. Just like $80,000. I mean, it's something unbelievable. That's very prohibitive, so that'd be interesting to talk to them. But yeah, great idea. We'll talk to them, see what they have to say. The other sheet of paper that you got was a little business card, so this is kind of how we're going to be advertising it. It'll have a phone number where people can call in and listen to where the mobile locations are gonna be. We're planning to keep them pretty standard, but obviously they'll change, I'm sure, a few times. So this way they can get information, and then they'll also get the numbers of our 2 people, Abe and Christina will be working it, and they'll get those numbers will be on there in case they wanna talk directly to somebody and have some questions or wanna know about recovery.
So it's mostly an information line is
Mhm.
what it is. It's
Yeah.
gonna be an information line.
Yeah, and that's what they'll use, and they'll probably start with the advertising. We pretty much are going to be starting at the surrounding syringe exchanges, because we have people utilizing those syringes from Mason County. So this will be an opportunity for them to not have to travel out of county to.
We're also applying for more funding for supplies, correct?
Yeah, well, yeah, thank you.
Yes.
So, yes, so I actually already have applied. We found out about another grant that Department of Health, when I complained to them about the 7,500, and I did complain nicely, but I complained. I said, but you told us 25,000.
You whined.
I did whine. And they said, well, we actually have some excess money, so we're going to be putting out an RFP. but you don't qualify to apply for it because you haven't started yet. You haven't been in operation with Department of Health. So they said, but you can apply with one of your surrounding counties that is in operation, and then you can both get more money. So rather than getting another $7,500, we applied for $40,000 with Thurston County. And we've already put that in, and so we'll see how much we get for that. And again, it's strictly, we're gonna use it, both they and us are gonna use it strictly for supplies. One of the things I ran into that was this shared service thing, and I told Dave about it. This, you know, there's a push from the state of sharing services between counties and everything, but the reality is it's not as easy as they make it out to be. Because one of the things that happened is we wanted to put a little bit of our administration, which literally was gonna be $500, into the request, and they came back and said, to be able to do that, we're going to have to do a special contract, we're going to have to come monitor you, et cetera, et cetera, et cetera. So we said, we'll find the $500 someplace else. We just want to get the supply money. But it's not that easy to do contracts with next neighboring counties, not to mention all the legal things that you have to go through. So, but it was really sweet. You know, I talked with them. I know John over there, who runs their program, and you know, basically said, hey John, are you going to apply for this? And he goes, well, I saw, but I wasn't sure. And I said, well, how about we go together and you get more money? So he was excited. So we'll hear probably in the next few weeks what we will get. We may not get the full amount, but it'll be nice. So that's more money. And then once we're in operation, we can apply. That we have a number of other organizations that once you've been operating for a while, you can actually then apply for funding. This first year is kind of nice because both Christine and Abe are funded under the Department of Health and the other two programs, and so their staff time will be funded by those programs because it fits within the deliverables of those programs. And so we won't have to worry about additional funding for staff time. It's covered for at least a year. And for Abe, it'll be covered for 2 more years. So we're excited about it. Questions?
How many people are gonna be in the band?
Well, from our staff, 2. We'll always have 2. There'll never be only one person, just for safety reasons.
And then, if we have partners come out, they will also.
And partners will join us. So we've talked to a number of different partners. We'll just have to see what that looks like. We have the STAR program, so peer recovery out of Thurston that comes into Mason, right?
Yeah, Thurston Mason. We've got Consejo's already said that they want to partner at least one time a month. Northwest will partner. Squaxin Tribal Behavioral Health. Some representatives from there will partner with us. We'll see about the Skokomish Health Clinic. Peninsula will as well. They've already committed. And a representative from Social Treatment Opportunities Program has said they'd like to partner as well. So plenty of folks from our treatment provider group are willing to partner. So.
Okay, questions? Community health assessment. I don't know how many of you got a chance to look at it. It's quite lengthy. But this is what we will be having the new, what are we calling it? No, the new organization.
Community forum.
You're calling it a community forum.
Yeah.
So the health forum organizations in the community that are doing health meeting together, and they'll be utilizing this to talk about whatever community health improvement they want to do in the area. So love your feedback on it. If you see an error or anything we've made, please, we didn't have it printed professionally yet because we wanted to make sure that we had like 20 eyes looking at it, but we thought we could always use more.
Feedback to whom?
Feedback to myself.
By when?
Oh, next couple of weeks. Thank you. Couple of weeks. If there's anything you want to know about, or any questions you might have of it, you can send to me, and I'll have Allison. Allison's done a great job on this, pulling it together, and
my contact information is on page 14 if you'd rather just send it directly to me.
yes, that's fine too. So, and yeah, just let us know what you think. Oh, that we didn't do. for time because the meeting got cut short, but you've been asking. So we do have a platform for the website to put data up on the website. It's called Live Stories, and Allison's been working on it. We were hoping we could kind of show it today, but because this meeting got cut a little shorter, we'll plan on next time being able to show you, and it will have a lot further work done on it. But it's basically going to be an opportunity for the community to see this type of information in a little bit easier presentation to digest, because many people don't get into charts and stuff like I do. And it'll have stories with it, and it'll have data there, picking out certain pieces of data pieces, and we want to make it available for the whole community. We're hoping the hospital will partner with us in this, and other organizations in the community that want to get their data out.
Is it live?
Live, you mean?
Can somebody look at?
It is
you
not
gave them a
live yet,
link.
is it? No, it's not live yet. It's just about ready to be made live, but yes, so.
So once it goes live, we can share the link so everyone
Yes.
can look at it.
Yes,
And,
we can do that, and then give us your feedback on what you think about it. Because it's something that you can change rapidly, you can put data in, it can even update data itself automatically, which is kind of nice. We don't have to keep putting it back in. It goes to certain resources and pulls the data, so kind of excited about that. Definitely by the next meeting, we will have it up and running for you.
Good report. Abe, just a request of you, we mentioned before the meeting started today that we were gonna budget to come up to the board at the hospital and make a presentation. If you would go ahead and send me an email in advance of that meeting with some specific suggestions, what we can possibly go ahead and tie back into you and the program down here to support it. I'll see if we can't grease the sled a little bit. No promises, but if you give me some information, some ideas.
Which board is this?
Say what?
The commissioners, the hospital commissioners board?
Yep.
I want to say we've had a wonderful interaction with your emergency room. They're just right on the ball. We've gotten things really squared away.
And the manager that was there at the meeting, Kristen, she followed
Did
through
she?
Yes,
with
she's been
Harrison
awesome.
Hospital,
Yeah.
Bim Bam Boom. It's like,
Yeah. Don't
Can
mention
you
her
clone
names.
her?
We don't wanna go ahead and lose her.
no,
Yeah,
no,
it's a
no.
great asset
You
for
can
the hospital
clone
and
her.
the community.
Yeah, that's awesome.
Okay?
Thank you.
Thank you, Lydia. Randy, you wanna say something, Coach?
Absolutely not.
Any other public comment, other discussion from the board members? Shall we adjourn?
Yes.
Okay, all in favor, thank you, have a good evening.
4 minutes early.
Thanks, Scott.